how are you doing?
Good, how are you?
I'm good. My name's Josselyn. I'll be your nurse today. I'm just going to go ahead and get my hands washed up and get my personal protective equipment before we get started.
Okay.
So I have my gloves ready to go for later. I have my stethoscope and I have a pen light. And I've already cleaned my materials. I'm just going to go ahead and do some hand hygiene before starting the assessment. Okay, so I'm going to be doing a head-to-toe assessment of you. So before we get started, do you use any assistive devices besides your glasses?
No.
Okay. And do you feel any kind of pain right now that I should know about?
I do not.
Okay, so throughout the assessment, just let me know if what I'm doing is hurting you or causing pain in any way, and we can look a little closer at that. Okay, so can you go ahead and state your name and your date of birth for me?
Heather Ray, May 20th, 1997.
Okay, and do you know where we are right now?
Portland, Maine.
Very good. And what is the date?
It is April 17th.
Good. So patient is alert and oriented ×3, full level of consciousness, and she is able to respond to commands. And she also has normal speech patterns, no slurring, and her speech is intelligible. Okay. I'm going to give you 3 words that you're going to need to remember for the end of the assessment. Lamp, bed, dog. Okay? So remember those for the end. I'm going to quiz you again.
Okay.
Okay, so we're going to assess your cranial nerves first. So can you raise your eyebrows up like this? Good. Can you give me a big smile? That's that frown. Puff your cheeks out. Good. You stick your tongue out. Good. And raise your shoulders up like this. Very good. So her cranial nerves are all intact. I'm going to have you close your eyes, and I'm going to touch you somewhere on your legs or your arms, and you need to tell me where I'm touching. Left hand. Good.
Right foot.
Right foot. Good.
Right arm.
Good.
Left knee.
Good.
Left shoulder.
Left shoulder. Very good. So her peripheral sensation is intact. So I'm going to have you put your hands out like this and touch your fingers to your thumb and the other ones. Good. Now put your hands on your legs and flap them back and forth. Good. So patient's fine motor skills are intact and sensitive, and patient is able to follow commands. So why don't you go ahead and stand up for me. So we're just going to check out your balance, which I think is good. Stand on one leg. Now stand on the other leg. Now go ahead and walk that way across the room. And walk back. Very good. Okay, so patient's gait and ambulation are both normal. Her coordination is good, and her balance is intact. While you're up, I'm just going to have you do some simple range of motion exercises for me. So can you rotate your left arm? Now the other way. Good. So patient has some slight crepitus in her left shoulder, but her range of motion is intact. Can you flex your left arm? Good. Range of motion intact. No crepitus noted. And go ahead and rotate your wrist around for me. Very good. No crepitus noted in the left wrist. Her skin is pink, warm, and dry, and her capillary refill is less than 1 second. Can you push your fingers out for me? Now squeeze them. Very good. Strength is 5 out of 5. Can you lift up on your hand? Now push down. All right. Strength is 5 out of 5 in her hands and arms on the left. So on the left side, on the right side, can you go ahead and rotate your shoulder again? Very good. Crepitus noted, and the right shoulder range of motion is intact. Can you flex your right elbow? Good. No crepitus noted in the right elbow. Range of motion intact. And can you rotate your wrist around? Good. No crepitus noted in the right wrist. Range of motion intact. Skin is pink, warm, and dry on the right. Great turgor. And her cap refill is less than 2 seconds on the right. A little slower. Can you spread your fingers out? Good. Can you squeeze mine? Very good. Push up. Push down. Very good. Patient is able to follow commands, and her strength is 5 out of 5 bilaterally. Just going to go ahead and check your pulses real quick. All right, 2+ on the right, and radial pulses 2+ on the left. Very good. Okay, so last thing, I'm going to have you pretend like you're diving into a pool and lean over. Very good. I'm going to check the patient's spine for any signs of scoliosis, kyphosis, or lordosis, of which she does not show any signs. Okay, you can sit back up. Now I'm going to have you take a big, deep breath. I'm going to check your lung expansion. Very good. Patient has big chest expansion. Okay. Are you ready to sit down?
Yeah.
Okay, good. Okay. Okay, so now we're going to do a quick head assessment. When I say quick, I really mean long. This one takes the longest. Okay, so her head appears to be proportionate to her body. Her hair is equally distributed. Is of a normal color, brown. I'm going to go ahead and put some gloves on and check out her hair for any critters. Crits. Gloves on, okay. I'm going to check for any lumps and critters in your head. Okay, no critters noted. And no lumps noted on the skull. I'm just going to assess your face, facial bones. If you feel any tenderness on your sinuses, let me know. Okay. Anything there?
No.
No tenderness noted. Jawline is intact. Nose shows no sign of breaks. Can you open your mouth for me? Okay. No TMJ noted. Slight protrusion of her jawbone on the right. Okay. I'm going to feel your pulses. Your carotid. Left carotid is 2+. Right carotid is 2+. No lymph node enlargement noted, and no enlargement of the thyroid noted. Can you swallow for me? Okay, swallowing is midline, and no lumps noted or lesions noted in the neck area. Okay, I'm going to go ahead and check out your eyes. So her sclera are white, and her conjunctiva is pink. Eyelashes and eyebrows are evenly distributed on the eyes. Her irises are brown, and pupils are about the size 3. Okay, I'm just going to check out your pupillary reaction, so just look at me. Good. Okay, and then follow the pen towards you. Good. So pupils are equally round and reactive to light and accommodation. And so just go ahead and follow this pen. So periorbital motions are intact, and she is able to follow the 6 cardinal fields of gaze. Want to go ahead and tell me when you see my wiggling fingers. Okay, peripheral field is intact and normal. Great. And no edema noted on the eyelids. Okay, her nose shows no signs of breaks. Can you lean your head back? And no drainage noted in the nares, and her septum is not deviated. Can you go ahead and breathe in and out through one nostril? Good, another one. Very good. Check out your mouth. Her lips are pink and moist. And inside her mouth, go ahead and say ah. Stick your tongue out. Okay, good. Her uvula is midline, and her mucosa are pink and moist. Her tongue is also pink and moist. Kind of look underneath. Very good. And her teeth don't show any signs of excess plaque or cavities. All right. Very good. Very good. All right, and then your ears. So I'm just going to check them out. No lesions or nodules notated with palpation and inspection. No excess drainage in the left ear. In the right ear, no excess drainage noted in the right ear. No nodules palpated. No lesions or rashes noted. Okay. All right. So I'm going to go ahead and put your glasses on. I'm just going to do a quick listen to your heart. Okay. So first, your precordium. I don't feel any heaves or frills. Listen to your sounds. First, the aortic valve. Pulmonary valve. Good. Herb's point. Good. Tricuspid valve. And mitral valve. Good. No whooshes or bruits noted in the heart. S1 and S2 both heard. Very good. Great. Nice heart. Pretty good heart. Thanks. Now while I'm here, I'm just going to also listen to your lung sounds. And see if I can hear any wheezes or anything. Okay, every time I touch it on you, just take a big deep breath through your mouth. Good. Good. No wheezes, crackles, rales, rhonchi noted in the right upper, left upper, right lower, and left lower lobes. I'll listen from the back. First to the right upper lobe. Now the left upper. The right lower. Now the left lower. Good. Again, no abnormal sounds noted in the back of the lungs. All right. And as we saw before, your chest expansion is fantastic. Okay, so go ahead and lie down. I'm going to do an abdominal assessment on you. Okay. Abdominal skin is pink and warm and dry. And I'm just going to go ahead and listen to your quadrants and see if I can hear some good sounds going on in there. First, I'll listen to the right upper quadrant. Sounds are normal active. Left upper. Sounds normal active. Left lower. Normal sounds. Right lower. Normal sounds. And then the abdominal aorta. No whooshing or bruits noted. Okay, now I'm going to palpate it real quick. If you feel any pain or tenderness, let me know. Okay, no pain or tenderness noted in the abdomen, and no lumps or lesions seen, and no hard spots, no obstructions in the bowel noted. Okay, now we're just going to check out your legs. So go ahead and extend your right leg for me. Good, bend. Extend again. Okay, range of motion, right leg is normal. No crepitus noted. Can you flex your ankle? Good. Point it. No crepitus noted in the right ankle. And skin is cool, pink and dry. And her cap refill is intact, less than 3 seconds. Let's check out your pulses. Pedal pulse is 2+. Posterior tibialis, also 2+. Can you pull back on my hand? Now push. Now push your leg down. Now lift it up. Good. All right, you can put it back. All right, we'll do the same thing with this one. Your knees. Okay. No crepitus noted in the left knee. Can you flex your ankle? Okay. No crepitus noted in the left ankle. Unable to check out cap refill on the left foot because she has toenail polish on. But her skin is pink, cool, and dry, and her pedal pulse is 2+, and her posterior tibialis is also 2+. And can you pull back on my hand? Now push, lift up on my arm, now push down. Good. Okay. So sensation is intact in the feet, and your pulses are also intact. Range of motion in the ankles and legs are both normal. And her strength is 5 out of 5 bilaterally in the lower extremities. Okay, so patient, you can sit up. Do you remember the 3 words that I told you at the beginning?
Lamp, bed,
house. Maybe. Lamp and bed were definitely 2 of the 3. It's almost like you've been doing this for the last 3 hours.
Yeah.
So her short-term memory is pretty good. And to decide it. I did a good job, Renee. Thank you. All right. Let me just look at you for a second and think about it. Yeah. All right. Well, thanks for coming in. See you next time.